I know a question I get is as far as some of these clinical decisions and that type of thing is that doctors are like, well, why should I follow that? Or it's kind of cookbook medicine, and what I'm starting to understand is a lot of these are very research based and evidence based type of medicine. That's the kind of things that we're looking for.
That's right. As it turns out, we all want uh, treatment protocols that have clear traceability back to evidence-based outcomes, and that's what all these folks are doing. I mean, that's what Mayo and Intermountain, and I think everybody tries to do that. The issue is, as a physician, you know this, that the variability associated with treating humans is so high. And so a patient can come and present one way, another patient can come presenting the exact same way, and it turns out they may have different underlying causes driving those presentations of illness. By trying to lock down on some of the variables, we're actually able to expedite moving toward better treatment outcomes. And I think that's what we're trying to do in software is to reduce some of the variation that's associated with treating, we humans.
And you made a couple of announcements already. What's were you able to share with us kind of that's anything kind of on the horizon as far as G healthcare, as far as things that you're looking for in the future?
Well, again, I think the announcement, two big announcements this week is the launch of Quilibria, which is our enterprise knowledge management tool, which we're very excited about. And then our e-health business, we're launching our next generation health information exchange infrastructure. Again, that's going to provide the ability to bring clinical information sharing to the healthcare ecosystem. The thing that gets General Electric Company and GE Healthcare IT so excited about this sort of, I'll call it the new sort of the new landscape of healthcare IT, isn't about getting I'll call it a dial tone out there so that we can exchange information. That's cost of business, and cost of business, and that's goodness. But what we're going to be able to do in the future is build some really interesting value-added capabilities on top of this core ability to share clinical information. Things like quality reporting, so that we can move healthcare from sort of best efforts to really a performance-based healthcare system. Things like chronic disease management, so that we can help folks that have diabetes or just heart failure, that are managing long-term disease states, manage it better, healthier, keep them out of the hospitals, and keep them living healthier through their disease states. We talked about Quilibria and things like clinical decision support, and then some really interesting things like population health, where we'll be able to bring all sorts of new information together and understand how pharmaceuticals and treatment protocols are affecting broad-based populations. That's very exciting. That's a vision that really inspires us.
Oh, great, great. So, Dr. Val?
This is a little off topic, but some of the doctors are saying that, how do you measure quality? And it's a little bit tricky, right? I mean, they feel that measuring physician quality is sometimes like judging a restaurant by its grocery list. You got to get the right variables, and I guess it can be complicated. I wonder if you, as GE, as you think about really trying to improve the quality of healthcare, how do you know how to go about getting the right variables and sort of making it as detailed as possible without sort of being on the wrong track? I know that's a tough question, but
Well, it's a tough question. It's exactly the right question to ask because it's hard. I mean, I think we think about quality of outcomes in terms of numerator and denominator, which is quality of care delivered per cost, right? And so we need to manage both. And it's tough in healthcare because, as you said, the quality of healthcare is something that's a little amorphous. It's a little hard to get your arms around. And I don't know that it's I don't think there's a silver bullet. There's no light switch to flip here. But I think we can do some smart things that will put us on the right journey to getting our arms around this. So things like getting more commonality around terminology, more understanding of things like activity-based costing, so that we actually know the true cost of care delivered, not just the claim cost of care delivered. That can help take care of the denominator. On the numerator side, I think we can't. There's the old adage: you eat an elephant sort of one bite at a time, right? So I think this is a good and apt analogy because we're not going to solve this overnight, But I think we can start picking off those disease states and treatments that we can start putting some quality measures around and iterate ourselves to something that 10 years down the road, 15 years down from the road will look much different than we are today. And I think this information transparency journey that we're on right now with things like e-health are going to help us tremendously in that regard.
And I think it's somewhat obvious why the Mayo Clinic would be a great partner for you because of their. I used to do research there, and I'm a big fan. And but I wonder how you can bring the excellence of Mayo, how you can help facilitate bringing the excellence of Mayo to America specifically.
Yeah. So they are Mayo and Intermountain both are just tremendous partners, and they're great health systems throughout the nation. But we're certainly very, very proud to have both of them as our partner. And but what you asked was a really hard problem, right? Which is, hey, if somebody's doing it right, how do we translate that, right? And it's one thing, and as physicians, you both know this. I mean that I wish everybody defined blood pressure the same way. They don't. I mean, simple things like that are different from system to system, and that's one of the reasons why we're so excited about this new product, Quilibria. Is it because there's a lot of infrastructure underlying this product that will allow something like true semantic and process interoperability from system to system. Developing best practice protocols in a hospital or in a system is one thing. Translating that across systems is a problem that's orders of magnitude harder. So GE has been working with Intermountain and Mayo for several years now, and we put about $100 million into developing the core infrastructure that'll allow us to translate this solution. And the good news for anybody listening to this is it doesn't require ripping out your existing systems. It actually layers right on top of the systems that you have today. So immediately you can plug this in, and it becomes a little bit like an Intel inside of the systems that you already have, and it can immediately start giving doctors, better information at the point of care where they need it. And if you're not Intermountain or Mayo, and you still think you're doing some great things in developing treatment protocols, and many folks are doing some really wonderful things, there's a rules engine that will allow you to develop your own treatment and protocol and codify that in your system. So you can start with sort of care bundles from what Intermountain or Mayo have done, but the things that you learn in your own system and hospital, you can actually instantiate those in rules as well, so that it helps you spread that amongst your own system as well.
Great. And for the people who can't be here, I know we do have some international viewers watching us live right now. Where can they find you guys on the internet?
Yeah, so ge.com, and you can navigate down to healthcare and find us at Healthcare IT. And we talk a lot about healthcare domestically, but the international markets are really doing some phenomenal stuff as well. All the things we talked about today are going to be available on the international markets as well. We're working literally on every continent except Antarctica to try to get this technology out there. And some of the problems that we think about healthcare here, but when you're dealing with 1.3 billion people in China or 1 billion people in India, the kind of healthcare needs that they have as countries are just different than what we have here. Information's at the core of trying to get at meaningful change in healthcare in those global markets as well. And we're very excited there too.
Well, great. Well, Earl Jones from GE Healthcare, thank you so much for being with us. Thanks for taking the time.
Yeah, my pleasure. It really was.
Oh, great. And Better Health coverage here at HIMSS 10. We'll be back in a few minutes.